Every year, 1 in 5 Australians are affected by mental illness. Mental Health Australia is the peak body that represents many of the service providers, professional groups, researchers, and also the state and territory organisations that are delivering mental health services right around the country. It also advocates for the rights of people with mental illness, promoting a national voice for those with lived experience of distress and mental ill health, as well as promoting a voice for the people that love them and care for them. Mental ill health has reached crisis point in Australia, and it's now widely considered to be one of the major health issues in the country. In this series, Walk the Talk, a Mental Health Australia production, I'll be interviewing a whole range of people about how we can improve the mental health of all Australians and also the opportunities that are there. I'm Brad McEwan, and I invite you to come on this walk with me as we together explore the ways in which we can achieve a more mentally healthy Australia. Leanne Beagley, thanks for joining me on Walk the Talk.
Thanks, Brad. It's terrific to be here.
Now, you started at Mental Health Australia just before COVID.
Yes, just as it began to hit.
What an introduction.
Yes, indeed, and none of us knew what was coming, did we?
How was it? You just had to get on with it?
Indeed. Well, we had to, like everybody, rethink what we were doing and how we were doing it, what the messages were that we needed to engage with the community about, try to think about things like not talking about social distancing, but talking about physical distancing, because we wanted people to stay connected. So it wasn't about the social distancing, it was about making sure you were keeping safe, but keeping connected.
Yeah, okay. The statistics now are showing us that mental ill health is roughly double what it was pre-COVID. Is it solely COVID responsible for that?
Well, I think we can all agree that things weren't perfect before COVID, and there's lots of reasons for that. But I think what's happened with COVID is that we've also got better at talking about it. And I think before COVID we talked about, when we said mental health, we meant mental illness. But I think now we think about it including distress and loneliness and disconnection and all of those things that are about anxiety. And so people are feeling more able to talk about those things, I think.
And Leanne, you strike me as a glass half full kind of person.
Yep, that'd be right.
Yep, so am I. There's so much hope now. We're at this point where it's all come to a head and everyone's going, right, let's make a difference.
Yeah, and let's work together on making a difference.
And have a lot of conversations.
Indeed. You know, it was very grey during the COVID time. Particularly here in Melbourne and you know, and Sydney in the longer lockdowns, and I think it was pretty hard for people to sustain their hope. But I think that as the world opens up and as kids got back to school and as families resumed their day-to-day sort of activities, we got to a point where we needed to, you know, start to think optimistically about the future. Yeah.
Absolutely. Leanne, I'm loving this chat, but I've got a dodgy knee and I know you've got a sore knee. Why don't we go and sit in?
Alrighty.
Leanne, given these statistics, how confident are you that we can make a difference and we can achieve a mentally healthy Australia?
I think we can do better than we're doing now. I think that we need to be practical about what's possible and achievable. But what it will take is working together across the community. And so that's not just government and all levels of government, but it's also about business and philanthropy and various other parts of the system to work together and to pull together to address the areas that each of those components can address. And what it takes is leadership, and it takes commitment to each other, and it takes, a bit like planning a big hike up Everest, It takes careful planning. And we also have a lot of challenges as a community to deal with. And focusing on mental health might mean not focusing on the challenges of housing or disability or climate change or some of the other, cost of living concerns, etc. We have to be able to walk and chew gum at the same time. We need to be able to stay focused on the issues around mental health and the solutions around mental health, as well as the challenges that we know, for example, our new minister's interested in, particularly around aged care and the workforce in aged care and primary care and GPs, and these are all really concerning issues in Australia, but underlying all of them is mental health. And every issue has a mental health impact. And in my view, the experts are people living with mental ill health and their families who know what it's like to struggle each day and to try and get through their own despair and feel defeated, and they will know what helped them the best to get through. And we don't listen enough, I think, to people with mental illness.
Because the reality is, the people that have mental ill health and the people that care for them, that's their life.
Yeah, that's right.
So we have to listen to them.
We do, and we need to take seriously what they say about what's working and not working. Particularly if you get to the point, and we know that most people who feel distress and are unwell don't actually seek help. So the very first step is acknowledging that you might need some help and knowing where to go, and even that can be a jungle. And so what we need to see is really clear advice and support for people wherever they are to look for help and to find it. And that's one of the real challenges at the moment, because we have a huge workforce shortage. We have investment in mental health programs that are a bit like a whole lot of jigsaw puzzles without a picture. We can't see what the picture should look like because we don't have a national plan for mental health, and that's what we need.
Okay, national plan, everyone working together, lived experience is vital. What's the first step?
Well, the first step, I think, is this survey that we've done, which is this survey in partnership with Ipsos, which is trying to tell the nation how difficult the problem actually is. Because once we understand what the problem looks like and the extent of the problem, we can start to work on the solutions. Now, we know that there are people who've made a lifetime of effort and research in helping us understand the problem. It's not like we don't know, and the stats are worrying. They tell us that young people, and particularly young women, are in a really bad way. So we do know that there are a range of problems that we need to address, and we need to treat it as the crisis that it is. We need to treat it as the burning deck, and we need to work together to drive change.
What do you say then to those people that see these statistics and they are quite forlorn about the state of mental health in Australia and their own mental health? Because right now there is an opportunity, and this is the point where we make a difference, isn't it?
Yes, well, I guess that's why we're so excited about the opportunity that World Mental Health Day presents, because World Mental Health Day presents us with an opportunity to focus a day on what can you do? What can I do about my own mental health? What can you do about yours? And how can we work together on that? And we're very keen for people to think about what they can do, almost like a New Year's Eve commitment, or a commitment to their family and to their network, to work together on something that they can do to improve their own mental health. And for everyone, they'll be starting at a different point. For some people, it might just be about really focusing on getting a good sleep, or on your diet, or on some exercise and connecting with people, or spending less time in front of the television and on the screens, or spending more time connecting with others. So we're calling on people to make a promise as a group in your community and social connections about how you might improve your own mental health, and really encouraging people to be strong about their own capacity to make change in their lives.
I'm Matt Berryman, 37 years young. I grew up in Wodonga, country Victoria. I'm a son, I'm a brother, I'm an uncle, and I experienced mental ill health. When I first got diagnosed with bipolar, the immediate reaction for me was that I just couldn't tell anyone, and there was only a couple of people that knew when I was diagnosed, and the society wasn't ready, in my view, in 2017, 2018, that someone as a leader of a business that was being successful as it was had a CEO and a founder that was so sick. So for me, I was always wearing a mask when I was outside, working and being professional, but behind closed doors, I was a mess. There was times in my journey that the darkness and the pain was so hard and so constant and intense, and I went through 5 shoulder reconstructions in my professional cricket career, and it felt like nothing compared to the pain I was feeling through my bipolar journey. So it was really about trying to absorb that pain to a point, and that's where it got to a point where I just couldn't absorb it anymore. Family's probably the hardest thing for me to kind of wrap my head around, especially around suicide, because I thought, and like many people in my situation that are suicidal or close to attempting suicide or are attempting suicide, you feel a burden to your family and you feel a burden to the friends and people around you. And for me, that was a clear feeling I felt, and I felt that I'd released that burden from them by doing it, when in fact it's actually the opposite, and the conversations I've had since really has shown that I would have just left a huge hole in their hearts and actually would have created more damage by completing suicide than battling through it to get to the other side and to get healthy again. My own lived experience has been challenging, and obviously being public about not just my bipolar, which I was in 2018 when I stood down as CEO of Unlocked, but now talking about suicide and the luckiness of me having a second chance to build a life again through the misattempt is obviously very challenging. But as the chair of Mental Health Australia, I felt the need to be authentic, and if I couldn't talk about my mental ill health journey, how would I expect anyone in the community to be open and honest with their journey? 5 years on, I'm now really, I suppose, happy with where my life is at. It's always a challenge suffering bipolar and having mental ill health, but the joy that I've got and the position I'm in, I do feel that there's a huge amount of hope that you can get through such a challenging period, and the support of family, friends, and obviously the medical team that I had was critical to me getting through probably the darkest hours that I went through. Be Here Tomorrow, day by day, was a really critical way for me post-attempt to really get through that period and make sure that I was never going to put myself in that position again.